Leaders of 20 major industrial and emerging countries are holding a health summit aimed at boosting access to coronavirus vaccines. They're expected to recommend more voluntary licensing of vaccine production. Currently, it's only these companies and their partners that are allowed to make the jabs. It's a fundamental principle of intellectual property law. But critics say it's costing lives. South Africa and India have led calls for patents to be open up to others. More than 100 countries, including the US, agree. But Germany rejects the proposal. So what are the arguments for and against? Well, backers say suspending patents would save lives and help economies reopen. They say pharma companies have benefited from government investment, but critics say it could compromise the quality of vaccines and hinder innovation. Well, let's speak now to Dr. Soumya Swaminathan, she's the Chief Scientist at the World Health Organization. Dr. Swaminathan, thank you very much. Welcome to Deutsche Welle. Waiving vaccine patents, is that what's really needed to tackle unfair vaccine distribution?
So we need a combination of things at this point. We are at crisis point, and as you were pointing out, we've had over 1.5 billion doses of vaccines distributed around the world. And guess how much went to low-income countries? 0.3%. That is a grotesque situation in a pandemic. And so we have to do everything we can to get vaccines to people to save lives. So the first thing is to share vaccine doses. Many countries have actually got more than 2 or 3 times the number of jabs they need to vaccinate their own populations. So even as they're vaccinating their own populations, they must start sharing with COVAX so it can go to the rest of the world. The second is that manufacturers must start doing more deals with other companies. So the big companies that have made successful vaccines must look for partners, particularly in the developing world, to expand manufacturing. And this could be done through voluntary licensing and tech transfers, or ideally, we would like it to be done through the pooling mechanism. We have set up something called the COVID Technology Access Pool, which is exactly meant in a pandemic to receive technology, know-how, intellectual property, and have a very fair and transparent way of distributing those licenses. And then finally, the IP waiver, which of course will help because it will get rid of all the number of legal battles that might have to be won, one country at a time. It would give a waiver for the pandemic, but it has to be accompanied by tech and know-how transfer.
The EU says it plans to support the expansion of vaccine manufacturing in Africa. Could this be key to better distribution of vaccines for future pandemics?
Absolutely. I think we have realized now that some places in the world have very little capacity. So Africa currently manufactures less than 1% of vaccines it uses on the continent. So Latin America is the same. So clearly we need to ramp up that capacity, strengthen existing manufacturers and develop new sites, especially for new technologies like mRNA. And yes, the European Union is very much supportive of this, but that's a more medium to long-term solution. It's not going to bring us the supplies in the next few months. That's why WHO has been pushing for a combination of measures to both immediately remedy the situation that we find ourselves in today, but also build that longer-term capacity, both to deal with COVID, because we're going to have it for the next couple of years. And so we are going to need that increasing supplies, and of course then to address other infectious diseases.
What lessons then would you say we've learnt from this pandemic that might assist us to do better next time?
Well, I think the most spectacular thing has been how science succeeded in finding the solutions for us. No one dreamt that we would have vaccines in under 12 months of the discovery of a new virus. Diagnostics, drugs, not so much, but there's some progress being made. But what hasn't worked is the distribution and the access of these. So while the upstream science and the research and development has really gone well, the scientists have done their job, but I think the rest of countries haven't done their job in enabling equitable access to these products. So what's the point of having good science and finding the solutions if there is no means to address this large problem?
Now, you've, of course, spoken Yeah, well, you've got, of course, spoken about the COVAX program, which is supposed to help that inequity. Now, one of the countries that was supposed to be one of the biggest contributors to the COVAX program was, of course, India. Now they're halting the exportation of some vaccines due to their own vaccination needs. How much of a hit is that going to be to the COVAX program?
Well, in the short term, it's a big hit because, as you know, a large number of the doses to COVAX, both the AstraZeneca Oxford vaccine, which is manufactured at the Serum Institute, and the Novavax vaccine, which will come on board in the coming months, also manufactured at SII in India, well, the biggest suppliers to COVAX. There will be other manufacturers coming on board in the future, but India is one of the largest suppliers of vaccines to the world. And so in the short term, this is a problem. Of course, everybody, I think, understands the domestic needs in India right now. And we hope that over the next few months, as things improve, that supplies to COVAX will resume.
Dr. Soumya Swaminathan, Chief Scientist at the World Health Organization, thanks very much for speaking to DW.
Thank you.